In this video, we're going to be talking about accommodation, or your eye's ability to look far away, read up close, and then transition back to looking far away. So what is accommodation? Accommodation is your eye's ability to look at something up close and then relax to look far away and simultaneously do those acts one right after the other. But let's start what happens when you look far away and then look at something up close. There are three things that happen in particular with what we refer to as the near point triad. There's three things that occur when you look at something far away and then look at something up close. So the first thing that's going to occur is that your eyes will converge. So as you look at something far away, as it gets closer, your eyes start to move inward just a little bit more to kind of help track and be able to read and see and do what you need to do in order to be able to read up close. The second thing that happens is called miosis. This is pupil constriction, meaning that the black hole in the middle of your eyes, the color portion of your eyes, of the iris, it will constrict down in order to be able to help you read better up close. And then the third thing that will happen is that the ciliary body will constrict. Now, what does that mean? The ciliary body is a muscle inside your eyes that has these little fibers called lens zonules that attach to the crystalline lens that kind of change the shape of the crystalline lens in order to be able to help you see better up close. The focusing portion of your eye is known as the crystalline lens. And when that crystalline lens gets fattened and thickened up a little bit more, that's what allows you to be able to read up close. So it changes shape. And it changes shape as you get older too. When you're younger, 5, 10, 15, 25, 30, 35 years old, your crystalline lens can flexibly change shape like an autofocusing camera, whether you're looking far away, looking at something up close, and not really have any difficulty with that. However, when you get into the 40s and 50s, that's when we start to see some issues with accommodation for patients that notice that they can't read up close without their readers, bifocals, progressives, trifocals, anything like that. That's what the crystalline lens should be able to do, but is no longer able to do due to time, due to birthdays, but also due to the lens just getting a little too fattened and thickened to where it can't focus the way that it used to, and that muscle can't move that fattened, hardened lens anymore. There are issues we also see with younger patients too with accommodative issues, whether they can't read, get double vision, headaches, eye strain, eye fatigue, double vision. You can also have this in adults as well too, but mostly we see this in kids. And there's a couple of things we like to do for that, whether they need reading glasses, whether they need bifocals, whether they need progressives, anything like that. There's different things we can do to help younger patients and older patients out with accommodative issues. Also, something that can be considered is the prescription eye drop Vuity. So what Vuity does, we talked about it in a previous video, is that it constricts the size of the pupil down, which is part of the near point triad, miosis, pupil constriction. That's what causes things to help you read up close significantly better, which has helped a lot of patients between the ages of 40 and 55. But now let's go the opposite direction. Let's go from looking at something up close to looking at far away. What happens there? So there's three things that happen there. If you're reading something up close, like a book, computer, whatever it may be, phone, your eyes will begin to diverge out. So they're looking at something like this, then they diverge and kind of change direction with eye muscles, nerves, things like that that kind of just expand the visual field out a little bit more. Your pupils will also dilate. They'll also get larger to take in more information, but also your crystalline lens is going to relax due to the relaxation of the ciliary body. It'll actually get more flattened in order to help you be able to see things further away. So it's the opposite effect of what happens when you read up close. If you're a younger patient struggling in school because it's difficult to read, there might be an accommodative issue at play. If you're an older patient and having difficulty to read, there might be an accommodative issue at play. So it can affect every age and every generation. It's just a matter of how it affects you, where it affects you, when it affects you, and why is it affecting you. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington. We'll see you next time.